Hello, welcome to BPS Live. I'm Steve Ronan, a plastic surgeon here at Blackhawk Plastic Surgery, and I'm here tonight with my co-host, Brett.
Hi, Dr. Ronan. So great to be back. It's been a minute.
Awesome. Tonight, we're going to talk about your face and your skin and the process of aging and some of the sort of more mild, moderate, or advanced signs of aging and types of treatments that we might do to help you along your journey. Let's talk about earlier on in the aging process, some of the preventive things we can do and some of the treatments we can do to treat aging early on and in a preventative way. Before you even come to my office, there's a whole bunch of things you can do. And that would include making sure you have a good diet and it should be high in protein. You want to avoid the sun to the degree that you can and use sunblock. There are definitely people who are more or less sensitive to the sun. There are some people that are very resistant, can tolerate the sun well, and really don't show a lot of photoaging. And there's others that burn quickly and show signs of photoaging quickly. And so you kind of need to figure out who you are and make sure you're protecting yourself from the sun. Smoking is an absolutely terrible thing to do to your skin. And so you can really even see the changes in the skin color of someone who's smoking. And so that obviously is one that you don't want to do. But as you start coming into our office, there's some simple things that we can do on the earlier side that can go a long way. One of those would be doing facials. And so with facials, we're sort of aggressively exfoliating the skin and cleaning out your pores and sort of pumping in some nutrients and hydrofacial, other types of facials that we have. Those can be fantastic for your skin. We'd want to treat and prevent acne. Acne that's bad can lead to acne scars. Acne scars are very difficult to get rid of. And so the prevention here is key. And so it may be as simple as some of the topical skincare products that we have in hydrofacials, and it may be a more aggressive treatment like laser that we have called the AviClear, which can reduce and or eliminate acne. We also have some laser and technology treatments that are pretty good for earlier on in the skincare process. That might be laser genesis, which is sort of a bulk heating that goes after fine lines and some reds and browns and collagen building, or maybe a microneedling type procedure, but some procedures that would be designed to keep your skin overall unhealthy that would not be super aggressive. So let's get into more moderate signs of aging and slightly more aggressive treatments. And so those are things I think people are pretty familiar with. As you're constantly frowning and forming crow's feet and you get into your late 20s, 30s, you'll maybe perhaps start to burn the wrinkle into the skin. So that means you can kind of see it even when you're not animating. You sort of have what's called a static wrinkle. And so we can prevent that from happening by keeping some tox going. And so the three most popular areas for tox would be the crow's feet, the frown lines, and the forehead lines. And so by putting some tox in, we can relax those muscles, not continually form the wrinkle, essentially prevent those wrinkles from burning into your skin or becoming deep or static. Another thing that's popular is that typically in the moderate phase, you're starting to lose fat in your face, which is one of the primary causes of facial aging is loss of fat. And so that might show up with the cheekbones being a little bit lower or a deeper nasolabial fold. And we can put some filler in there to sort of push out lift up the cheekbones and push out the nasolabial folds. If your fat loss is a little bit more aggressive, we might go right into fat grafting, which is a relatively small procedure. Poke hole down your abdomen to take out some fat and a couple needle sticks in your face to infiltrate, through the lower lid, cheekbone, nasolabial area, marionette, and wherever else on the face needs it. But that's all essentially done through needle sticks and is a fairly small procedure to have. We also might look at some more aggressive laser and or other technologies. And so if there's a little laxity in the skin, we might do an Ellacor. Ellacor removes tiny cylinders of skin or punches of skin that are so small it doesn't leave a scar. But when we remove thousands and thousands of them in a zone, it provides some tightening. And so that might be something for someone with a little bit of laxity. If someone has fine lines and we kind of think their skin could be healthier or more robust, we might do a microneedling procedure, which is really a massive collagen induction procedure. It also kind of helps work with fine lines and wrinkles. We might do a light version of a fractional CO2 laser that would heal very quickly, as in like a day or two. And you'd really just kind of look like you have a sunburn for a day or so. And that's also fantastic for fine lines and wrinkles, especially when used serially. Someone in this moderate aging zone also might elect for some smaller surgical procedures. So for example, something that's really fantastic for younger people is just a plain neck lift. A neck lift makes it sound bigger than it is, but it's a poke hole behind each earlobe that's very small and a small incision under the chin. And we basically remove all of the fat under the skin. We remove the fat under the deeper layers of the muscles and then tighten up those muscles. That prevents banding in the future. And the skin sort of redistributes and goes, if you have a neck that's kind of coming this way, when we free up the skin and then take out the fat in the triangle, the skin laxity will then go up to two sides of the triangle, and that absorbs the laxity and makes it appear quite a bit tighter. And so relatively small procedure, takes less than an hour, that we oftentimes do on younger people with just doing the neck. We also do that with faces later on. That's a little more aggressive procedure. Another thing that we often do for people showing moderate signs of facial aging is a hair transplant. So the hairline's moving backward. There's some temporal recession, maybe across the mid part. There's some hair loss, and so we can either tackle that medically and or with a hair transplant, which is a procedure that's done under local anesthesia. And we can replace the hair that's been lost and restore sort of a youthful hairline. We want to make sure it's an appropriate and natural hairline and not be too aggressive about that. But a hair transplant can really go a long way to help someone really look and feel quite a bit younger and more confident. So we can talk about more advanced signs of facial aging and procedures that we might do to address them. The mainstay is going to be surgery here. And a typical face would be a face, neck, lids, brow, fat grafting, and laser resurfacing. That's probably one of our most common facial procedures that we do. And that's for someone that has lost enough volume in their face that they've hollowed out under the lower lids, deflated enough to create some jowling, and perhaps a little bit more to create some laxity into their neck. Maybe the brows have kind of slid down on the outsides and are covering the upper part, or create the illusion of fullness in the upper lid area. And then you're looking at some more significant signs of photoaging, or browns and reds and more significant wrinkles. So any of those kind of problems, we're typically going to need to do a more advanced procedure. With respect to your skin, different things can be happening now. And so we use different types of technology. The rosacea might be advanced enough, or the redness in the center part of the face, nose, and in the central forehead, that can be advanced enough that it's causing some thickening of the skin, dilation of vessels, etc. And so we'll use a little bit more aggressive laser treatments to attack those. If you're usually men and the skin on your nose has really thickened up from that, which would be called a rhinophyma, that would be something that Winston Churchill or Bill Clinton has. And so we might be able to shave that skin down and actually completely smooth that out, and then use a laser procedure to kind of keep it that way. The sun damage that you received early in life, which if you were sensitive to that and it's really showing, it may take a plan to address that over a period of time as opposed to one and done. And so we would want to have you on a good skincare program. We want to have you doing maybe a big laser and then serially small lasers to help maintain your skin into a good condition and help prevent the recurrence of the photoaging signs. Another thing is, again, hair transplants are super popular in this more advanced aging population, which would be maybe 45 and above. We're doing tons and tons and tons of hair transplants. And often at this point, someone would maybe be getting their second one. But again, one of the more popular things that we do, and for both men and women. And so I can give you a little picture of what that looks like for each. For women, so when we do a hair transplant, oftentimes we'll shave the back of the head, an area, in order to harvest the grafts. And so if you have short hair, it's really pretty easy because we just, shave that short, blend it in, and it grows out very quickly, and you're kind of back to normal, very, very quickly. For people with longer hair, especially women, you don't want to shave the whole back of your head because it might take you 2 or 3 years to regrow that all out. And so we can do something that we call hybrids, where we take a strip, which would leave a scar across the back of the head. But when you have long hair, you'll never see it. Hair that's short like mine, you potentially would see a strip scar. And so we wouldn't want to do that. But if you have longer hair, we can shave a narrow piece, take that out, and maybe a little bit of the FUE grafting in and around that scar, so that we can really get a lot of grafts to do a nice transplant. But when you leave, there's very little area that's been shaved on the back of your head. And so that's super popular for women because they don't have to shave the back of their head to have a hair transplant. After someone does a facial rejuvenation surgery, we'll often create a maintenance program for the patient, and that'll be sort of multimodal. We'll have our estheticians work with the skincare program and then monitor that over time with the patient, adjusting products as needed for that patient's skin. We might suggest, depending on how much photo damage or wrinkles that you have, we might suggest some follow-up out of the OR, smaller laser procedures to work on wrinkles. We may have cleared a lot of photo damage and wrinkling with the big laser in the OR, and then we'll see more of the reds from rosacea in telangiectasias, and we might do an XLV treatment after to clean up some of the reds. So really, depending on what you need, we can sit down with you and create a maintenance program that will kind of help preserve things and keep you looking at your best. The development of a plan starts with the consultation. And so at the consultation, I'll pull out of the patient all of the things that bother them. I don't want really to hear what procedures they want. I want to hear what's bothering them, what problems that they have. And so we'll make a list of those. And oftentimes the treatment is not what the patient initially thinks. It might be something smaller, it might be something bigger. But really what I try to do is pull out all of the problems and all of the things that are upsetting or concerning to a patient. And then we look at that whole package, and then we'll create a plan to address that. And we might just be doing that plan on the sort of earlier side of aging. We might do another consultation after having a face done and create a plan for someone to help maintain that. And so it sort of all starts with a consultation and an individualization of a plan of care for a particular patient to address what their needs are and work within how aggressive or not aggressive that patient wants to be. That's it for this segment. Brett, do we have any questions this week? I know people sent some in over social media last week. Why don't we go ahead with those?
Yeah, definitely. We got lots of great questions. How about we start with Sabrina? She wanted to know, what is a better option for filling hollowness under the eyes? Filler or fat transfer?
Ooh, that's an easy one. Okay, so I am a big believer that we should not be using injectable fillers in the lower lids. Far too many people have complications from that, which include prolonged swelling that can go on for years. And so I think that's an absolute no-no. Not a fan at all. The best way to fill lower eyelids volume loss is fat. And so by the time you're showing volume loss in your lower lids, you've already lost quite a bit of volume in your face. Facial aging happens by loss of fat. And so it starts a little bit everywhere over time. And again, by the time it shows up into your lower lids, your actual volume loss is, fairly significant. And a little bit of filler isn't going to go very far. And in addition, it can lead to swelling that goes on for quite a long time. And so the best way to fill lower lids is to add volume in the form of fat. And so we make a little poke hole in your belly, take out a little bit of fat, process it in a certain way, and then we'll graft it not only into your lower lids, but into your cheekbones, your nasolabial folds, down the marionette area as well.
Oh, that's great. I have another one from Barbara. She asks, what delivers better results, chemical peels or the microneedling?
Well, better may not be the best way to ask that. They're sort of different. So chemical peels will peel off the outer layer of the skin, and microneedling doesn't peel off skin, but then creates injury that causes a lot of collagen induction. And so they're really just kind of different things. Just like there's lasers that work on brown spots or red veins or fine lines, or different things. So the technologies will target different problems in your skin, and we need to choose the right one for your skin depending on what we want to achieve. So it's not really a matter of which one's better. They're just kind of a little bit different.
Perfect. Christina asks, is CO2 laser the best laser to improve my skin?
All right. Good question. And it sort of is a similar answer to what I just said. So what we need to do is first identify what are the problems in the skin. And so that might be brown spots, it might be wrinkles, it might be rosacea, might be fine lines or texture or pores. And then we need to consider the skin type that you have and what's a safe laser for you. And then we sort of pick a technology that will address our needs. So it might be different in someone who has melasma versus someone who has rosacea versus someone who has, a darker skin type and fine lines. And so there's not one laser for all. And so we need to figure out what we want to achieve and then what type of skin do we have, and then choose a technology that will attack that problem and that would be safe for that patient.
Rupali posted a question. I have new acne and dark spots, and now with pregnancy, what can I do post-baby to get my skin back to the way it was?
So two different problems. One's acne and one will be brown spots. And this is so post-baby, so not while you're pregnant. Browns and melasma, especially after pregnancy, can be very difficult to deal with. And so I don't ever think of browns on the face as a one and done treatment. It's sort of more like you're fighting a longer term battle or war, and you have to be consistent, and sometimes with multiple things. So there's some topical skincare things that we can do. In addition, there's some laser type treatments that we can do. And again, depending on your skin type and how sensitive we think your brown spots are, there's even different types of lasers that we'll use. So for example, someone who is very sensitive and prone to melasma, we would use a pico type laser, which means that we deliver the energy pulse in billionths of a second. And that really doesn't allow the tissue to heat because it hits it so fast. And that's really good for someone who has more sensitive browns or melasma after pregnancy. And with respect to acne, that's also something that we deal with. And that's also sort of a multimodal type treatment. One thing that we'll do is skincare with anti-acne type products. And then the other thing that we'll do is a laser. And I'm actually medical director of a laser company. And so I help them develop and test and do FDA approvals to bring to market new lasers. And one of the lasers that we have more recently brought to the market is called AviClear. And so this is a laser that actually significantly reduces and or cures acne for lots of patients. And so it's a quick, about half-hour procedure where we sort of do a laser procedure on your face with you awake. And it targets the sebaceous glands and sort of dries them up so that we have a significant reduction in acne over 2 or 3 treatments. And so both of those, it's kind of a combination of things with topical and technology.
I think that actually covers a lot of the acne questions we had. That's really good. Lydia wanted to know, how long is it going to take to recover from a facelift?
For a facelift. Okay, so if we do what we kind of call around here the usual, which means everything on the face, which is typically face, neck, forelids, brow, fat grafting, and laser. And that's sort of like a standard package that we'll do with faces. And for most of our patients, they'll be out in public in 2 weeks or less. 3 weeks low impact aerobics, 2 months before you really exert yourself in the gym. Typically with the facial procedures that include laser, every day you look a little bit worse for the first 4 days. And, you might get a little anxiety looking into the mirror going, why am I getting worse? Every day, a little more swollen, a little darker, and then it all kind of peels off and you have this fresh new skin underneath and the swelling starts to come down. And that happens around day 4 or 5. And then things kind of rapidly improve. And so the anxiety you have that's kind of growing the first few days kind of resolves. And when you're at your 1 week appointment, people can usually kind of tell they're really like on the mend. The next week, they'll improve quite a bit more and they'll be ready for public.
Steve has a facelift question. Where's the scar for a facelift?
Good question. Okay, so if we're going to do what the package that I talked about, which is face, neck, lids, brow, laser, fat grafting, you'd have a small incision underneath your chin, and that's what we're going to use to tighten up your muscles and remove the fat underneath the muscles, sort of in the deep plane. And then you'd have a scar that goes from your sideburn, and it follows the little curves around your ear, goes behind the bump, and then halfway up the back of the ear and stops. And so we do short scar facelifts as opposed to a traditional, which might start up higher and come down and then go all the way up the back of the ear and then along the hairline. This scar along the hairline, I think, is pretty obvious and pretty visible. And so it's difficult to put your hair up or have short hair if you have that scar. And so I don't like to make it. So we just do short scar. There's a little one in your hair behind the hairline for the brow, which is about 2 centimeters long or 1 inch maybe. In the crease of your upper lid to remove the skin there, and then right beneath your eyelashes on your lower lid. And that is pretty much all the scars for an everything type face.
Leah posed a question, is there a good skin tightener?
You're probably referring to a less invasive type skin tightener would be my guess, because one of the great skin tighteners is to remove skin. That's the ultimate skin tightener. But as far as a device or technology goes, one of the newer ones out there is actually called Elicor. And so I remember long ago in the basic science studies, we really, back when I was a resident, we kind of figured out that you could take out a tiny amount of skin, and if you did the punch small enough, it would heal without a scar. We thought, wow, that's really cool. Someday there'll be technology that we can take out lots at one time. We didn't have that technology back then, but we knew theoretically it was possible. And so that day is here, and we're able now to take out punches of skin that are about 0.45 millimeters, which don't leave a scar. But when you take out 18,000 of them, maybe across your lower face, that provides an actual real amount of skin that we're removing, and it provides a nice little tightening of that skin. It also can help with the texture and sort of deeper wrinkles and some sort of ruddiness of skin. It's kind of helpful for the smoothing. And so, as far as skin tightening technologies go, right now I think that's the best one, and that's my favorite one to use. Would be the Elocore.
Yeah, we've been doing a lot of those lately. We have time for 2 more questions. Cindy asked, what is PRP and how is it used?
It's PRP stands for platelet rich plasma, and so what we do is we take some of your blood, and that's like your whole blood. And when you spin that in a centrifuge, the heavier parts, go to the bottom. And so all the red blood cells kind of go at the bottom. And then there's like a little layer of white blood cells on top. And then above that is sort of a yellowish serum or plasma. And the platelets tend to congregate towards the bottom of that plasma layer. And so right above the white cells. And so if you spin blood down with the right type of equipment in the plasma layer, if you take the bottom half, that would be the platelet rich plasma, or that's where the platelets are concentrated. And so that's platelet rich plasma. And so it's used really lots of places in medicine. It is very useful, and then it's also sort of misused in some places. So orthopedics, neurosurgeons are using platelet plasma to inject around joints that are inflamed or have maybe a torn ligament or a strained ligament, and it kind of helps with inflammation and to bring in some of the growth healing factors. And so we've recognized some of those advantages in plastic surgery as well. So on all my facelifts and necks and different procedures we do, we'll spray in platelet plasma with thrombin and sort of make your own glue that is PRP as well. And we think it helps limit the swelling and bruising the patients and makes them sort of recover a little bit faster. It can be misused. So in order for PRP to work, it has to have access to the body and some type of inflammation. So if you were to do a microneedling procedure, which would make thousands of little needle sticks all over your face, which would create, again, thousands of little injuries, and then you put PRP in, the PRP can go through the needle sticks into your skin, see the injury and inflammation, activate, release its little goodies that it has, and attract lots of healing factors and help your skin recover. And so we see on laser patients in the recovery room, when we place it on top of their faces, we'll watch the redness sort of reduce almost immediately as the PRP gets working. Where it won't work is just like putting it on the outside of your skin, because there's a barrier there. It won't really do anything. There's also people who will just inject it and sort of pretend like it would work like a filler. But because you're just injecting an area and there's not really any inflammation or injury, it's not really going to do a whole lot. You're taking blood out of your body and just kind of putting it back in. And so you want that the platelets to be around some sort of injury inflammation, and then that really revs them up to go and get to work.
Last question is with Ben here. Are you awake during your hair transplant surgery?
Oh, I thought he was just asking if I was awake tonight. Yeah. So yes, you're awake during a hair transplant surgery, and hair transplants are long procedures that might be 8 to 12 hours long. And so we wouldn't want to obviously keep you asleep that long with anesthesia. But it's a relatively small area that I can numb up on the back of your head. And then we're harvesting, maybe 3,000 grafts sort of individually, and that takes a while, right? And so it's easy to numb up a relatively small area, and then do a hair transplant, and numb the different areas as we go. And when you're having it done, it's pretty casual. If you have to get up and go to the bathroom, you go. If you have to stretch your leg for a minute, we stop and you do that, and we take a little lunch break. And so it's definitely something you can be awake for. You can have ear pods in, you can listen to podcasts, you can listen to music, you can just talk, or take a nap. And a lot of our patients take a nap while they're getting the hair transplant.
That's all for our questions tonight. Thank you so much. Book an appointment with us, free consultation. You can see our QR code on the screen to book a consultation via our website, or go to blackhawkplasticsurgery.com and schedule a consultation there, or just give us a call.
Well, thank you everybody tonight for tuning in to BPS Live. We appreciate your support. Tahoe is not going to make an appearance today. He's taking a nap. Thank you, Brett, for helping me out tonight, and we look forward to seeing you all on the next edition of BPS Live.